Hello, I'm Dr. Roshni Jhan Ganguly, and today I will be talking about nationwide home visits, the NationWide's perspective. Now, home visits are an eye-opener, and most of the time it gives us some hidden and critical information which is required for the holistic management of the patient. The process that we follow at Nationwide is that the patient calls up our home health call center. The triage is done to categorize the problem, one by location and second is by severity. Accordingly, the respective doctor or the home health doctor is allocated to do the home visit as per availability. And finally, after completion of the home visit, we send an email to the home visit team. The types of home visit we do at Nationwide can be categorized into the following categories. One is the simple illness management for homebound patients who are unable to come to our clinics, mostly catering to the acute and the chronic conditions that we deal with. And second category is the dying patients or the patients to whom we offer palliative or terminal care. Sometimes we often do death pronouncement or grief support. Hospitalization follow-up is another important aspect that we cater to, and coincide services like health promotion and disease prevention is most of the time accompanied with the other home visits. The key areas of assessment are the physical health assessment, which includes a complete history taking and examination, functional assessments and abilities of the patient, especially of the geriatric patients who we cater to. Mental health is an important other assessment category that we do on a regular basis. Most of our old patients that we have are on different medications, so regular checking of their medical list and the medicines can be tailored according to the requirement. Environment and safety is another important aspect that we need to look into. Is the home environment safe enough for them to cope up with their present medical requirements is important for us to assess. And last but not the least, the caregiver issues are to be dealt with too. To give you an example, I had an 84-year-old gentleman who is a known case of diabetes, high blood pressure, ischemic heart disease, and on multiple medications, who presented to me with frequent falls and numbness in the hands. He also mentions that he has been losing his muscles gradually and feels very weak. He has been living with his son and daughter-in-law in Bangalore, and both of them have a traveling job. Hence, it is difficult for them to be at home, and most of the times he is alone with his grandson. Now, in this kind of a situation, what are the services that we can offer to him to make his life easy and to cater to his present problems? The best way to go forward would be to create a problem list in which we do assess all the categories that I have mentioned before. Also, in this case, we were happy to give him various kinds of services. First, including the doctor's home visit, in which we diagnosed the present problem and addressed the other multiple comorbidities that were there. We could provide a home nursing service in which the collection of blood sample and the ECG was done. Physiotherapist also had a role to play in strengthening his muscles and giving him the interferential therapy. Also, we had to look into home delivery of medicines because most of the time he would be alone and unable to procure the medications. And last but not the least, cost-effective management is what we also look into, which is tailored according to the needs of the patient. Thank you so much.